Obesity is a global epidemic. I mean, this is really a big problem. So 05 estimates of 1.6 billion overweight adults worldwide, you know, up to 2015, 2.3 billion. I mean, we're almost looking at, you know, another billion people who are going to be considered overweight. And then obesity from 400 to 700 million. That's an incredible amount. And really a problem in the United States. 2005, 2006, looking at adults 20 years and over living in the United States, 32% are overweight, 34% obese, and 5.9% are extremely obese. So this is not, you know, just a few people here and there. I mean, this is a big proportion of our population. So the World Health Organization has defined overweight and obesity as abnormal or excessive fat accumulation that presents a risk to health. So you can definitely have, and I have patients in my practice who maybe they've got a few pounds, you know, more than they could use on their frame, yet they're physically active, they eat really well, they have good markers of cardiovascular health and glucose health when we look at their blood testing. I mean, essentially, they're really healthy people, even though they have a few extra pounds on them. So we really need to think about who are the people at risk from having these extra pounds versus the people who are not at risk from having some extra pounds. So some of the risks that are associated, metabolic syndrome or insulin resistance, which can then lead to type 2 diabetes, cardiovascular disease, these are all of the sort of downstream consequences that can happen from obesity that will really sort of complicate an individual's life, really decrease the quality of their life. And not to mention obesity in and of itself confers poorer quality of life. You know, people, the aches, the pains, the difficulty getting around, you know, for this, there's some really important reasons to treat that.